Why is splinting a broken bone important in first aid? Imagine you're out hiking or at a sports event when suddenly someone falls and cries out in pain. You see a limb bent at an odd angle, and it's clear something's wrong. What do you do next? Knowing how to splint a broken bone can make all the difference in that moment. Splinting a broken bone is about more than just stopping the pain. It helps keep the broken pieces of the bone in place so they don't move around and cause more damage. When a bone breaks, blood vessels, nerves, and muscles nearby can get hurt too. If the broken bone shifts, it can cut off blood flow or damage nerves, leading to serious complications. By immobilizing the injury with a splint, you prevent the bone from moving. This reduces pain because movement worsens the injury. It also helps avoid further damage to soft tissues and blood vessels. If you need to move the injured person to get medical help, a splint keeps the injury stable and makes transportation safer. A good splint should extend beyond the broken area, covering the joint above and below the fracture. This gives the limb proper support. It's important to secure the splint snugly but not too tight, so blood can still flow. After splinting, check the person often for signs of poor circulation, like numbness, coldness, or pale skin. If these happen, loosen the splint slightly and seek medical help immediately. You can make a splint from sturdy objects like sticks, boards, or rolled-up newspapers. If you don't have rigid materials, soft items like blankets or clothing can work, especially for small fractures. Always cover open wounds before applying a splint to prevent infection. If the injury is in a limb, buddy taping the injured finger to an adjacent finger can help stabilize small fractures. Applying ice wrapped in cloth can help reduce swelling and pain after splinting. Remember, splinting is a temporary fix. It keeps the bone in place until a healthcare professional can provide proper treatment. Monitoring for signs of complications like increased pain, numbness, or color changes is essential. If you notice any of these, loosen the splint and get help right away. In emergency situations, knowing how to properly splint a broken bone can prevent the injury from getting worse. It's a simple but powerful skill that helps keep someone safe until they can see a doctor. Proper splinting reduces pain, prevents further injury, and makes transportation to medical care much easier.